Prostate cancer 13 first signs and symptoms. Don't ignore. Did you know that prostate cancer is the second most common cancer among men, behind only skin cancer? What happens in your body when this type of cancer starts to develop? And what are the silent signs that could save your life if detected in time? Thousands of men receive this diagnosis every year. But the good news is that, when discovered early, prostate cancer has a high chance of being cured. However, many ignore the initial signs or don't even have regular checkups, increasing the risk of complications. Therefore, understanding the signs, causes, and how to prevent this disease can make all the difference in your life and that of your loved ones. Let's get started. What you don't know about prostate cancer could save your life. Prostate cancer is a reality that many men prefer to ignore, but which can be decisive for men's health. According to the American Cancer Society, 1 in 8 men will be diagnosed with this disease at some point in their lives. This cancer affects a small gland located just below the bladder called the prostate, responsible for producing seminal fluid. Although prostate cancer is usually silent in its early stages, it can cause serious and even fatal symptoms if not treated in time. Most cases are classified as adenocarcinoma, a type of cancer that begins in glandular cells. There are 2 main types: slow-growing ones, which can go years without showing symptoms, and fast-growing ones, which are much more aggressive and dangerous. Although many men live with the disease for years without major impacts, it can spread to the bones, liver, or lungs, causing serious complications. This spreading process, called metastasis, is what makes prostate cancer even more dangerous. Fortunately, modern treatments and advances in medicine offer a range of options for dealing with the condition. However, the key to success is catching the problem early. Simple tests, such as PSA, prostate-specific antigen, and digital rectal examination, can save lives. Even so, the taboo surrounding the exam and the lack of knowledge mean that many men avoid seeing a urologist. Furthermore, early diagnosis allows cancer to be treated before it spreads, drastically increasing the chances of a cure. Ignoring the signs or avoiding exams can be very costly, both in terms of health and quality of life. Therefore, it is essential to know the symptoms, understand the risk factors, and, above all, adopt habits that help prevent prostate cancer. Remember, your health is in your hands, and acting in time can make all the difference. Types of prostate cancer. Understand the differences and dangers. Not all prostate cancers are the same, and understanding the types can help you better understand the severity of the disease and the treatment options available. The vast majority of prostate cancer cases, around 95%, are classified as adenocarcinoma. This type of cancer develops in the glandular cells of the prostate, which are responsible for producing seminal fluid. Although it is the most common type, it exhibits different behaviors. Some grow slowly and may never cause symptoms, while others are highly aggressive. In addition to adenocarcinoma, there are rarer types of prostate cancer, such as small cell carcinoma, which grows quickly and is more difficult to diagnose in the early stages. There are also sarcomas and squamous cell carcinomas, which are extremely rare but generally more aggressive. Another important distinction between types of prostate cancer is their rate of growth. Slow-growing cancers can take years to cause serious problems, and in some cases may be monitored rather than treated immediately. This approach, known as active surveillance, is recommended for men with low-risk prostate cancer. Fast-growing cancers require immediate treatment as they can spread quickly to other parts of the body. These cases often involve more aggressive therapies, such as surgery, radiation therapy, or hormonal treatments. A critical aspect is that more aggressive prostate cancers are more likely to invade neighboring tissues and cause metastases, especially in the bones, liver, and lungs. This spread makes treatment more complex and significantly reduces the chances of a cure. Experts still don't fully understand why some prostate cancers grow slowly while others are so aggressive. Genetic factors, age, and lifestyle can play important roles, but each case is unique and requires a personalized approach. Therefore, it is essential to undergo regular exams, which can detect changes in the prostate before symptoms appear. With early diagnosis, it is possible to identify not only the presence of cancer, but also the type and rate of growth, allowing for more effective and targeted treatment. Remember, The sooner cancer is identified, the greater the chances of controlling the disease and avoiding serious complications. Why skipping checkups can cost your health. Prevention is always the best path, but when it comes to prostate cancer, early detection is the factor that can literally save lives. Unfortunately, many men avoid regular checkups out of fear, shame, or simply underestimating the severity of the disease. This attitude can lead to devastating consequences, as when prostate cancer is detected in advanced stages, treatment options become more limited and less effective. Prostate cancer in its early stages is silent. This means that, even without apparent symptoms, the disease may be progressing in the body. Preventive exams, such as PSA, prostate-specific antigen, and digital rectal examination, are essential tools to identify changes in the prostate before symptoms appear. Often, men who feel good believe they do not need tests, but this perception is misleading. Preventive exams help detect not only cancer, but also benign conditions, such as prostate enlargement or inflammation, which can also impact men's health. Rectal examination, despite being surrounded by taboos, is quick, painless, and highly effective for evaluating changes in the size, shape, or texture of the prostate. The PSA test is done through a simple blood test, which measures the levels of a protein produced by the prostate. High PSA values may indicate changes that need to be investigated further. The advantage of having regular checkups is that when prostate cancer is identified early, the chances of a cure are extremely high. Additionally, early treatment is generally less invasive and has fewer side effects. On the other hand, when exams are ignored and the diagnosis is made late, treatment options may involve more aggressive procedures such as extensive surgery, radiotherapy, or chemotherapy. These interventions, although they save lives, can cause significant impacts on quality of life, such as urinary incontinence or erectile dysfunction. Therefore, viewing a checkup as an investment in your health is essential. Leaving aside fear or prejudice regarding preventive exams is the first step to protecting your life and ensuring a healthier future. Remember, time is your greatest ally in the fight against prostate cancer. Schedule your exams regularly and always stay up to date with your health. 13 warning signs of prostate cancer you cannot ignore. When it comes to prostate cancer, the body often sends signals that something is not right. Identifying these signs early can make all the difference, considerably increasing the chances of successful treatment. Let's break down each of these signs so you know exactly what to watch for. 1. Pain or burning when urinating. If urinating is becoming an uncomfortable experience, with pain or a burning sensation, this could be a sign that the prostate is enlarged or obstructed. This pain may be the result of an infection or, in more serious cases, changes caused by cancer that compromise urinary flow. 2. Frequent urination during the night. Getting up several times during the night to go to the bathroom is not normal. This constant need, known as nocturia, may indicate that the prostate is pressing on the urethra or bladder. 3. Presence of blood in urine. Blood in the urine is an important warning that should never be ignored. It can appear in 2 formats, visible to the naked eye or detected only in laboratory tests. In both cases, it may be a sign that prostate cancer is already at an advanced stage. 4. Pain in the back, hips, or legs. Experiencing persistent pain in these regions can be more than just discomfort. When prostate cancer spreads to the bones, these deep, continuous pains are common signs. 5. Unexpected weight loss. If you're losing weight without making changes to your diet or exercise routine, it's important to investigate. This weight loss may be the result of metabolic changes caused by cancer. 6. Discomfort in the rectal region. Prostate cancer can affect nearby areas, such as the rectum, causing pain, constipation, or even changes in bowel habits. 7. Pain when sitting. Feeling uncomfortable when sitting, especially on hard surfaces, may be related to prostate enlargement caused by cancer. 8. Difficulty to urinate. If you have difficulty starting or maintaining urine flow, it is likely that the prostate is compressing the urethra. This can lead to urine retention and more serious complications. 9. Loss of bladder control. Urinary incontinence, like involuntary leaking, can be a warning sign, especially in more advanced stages of cancer or as a side effect of treatments. 10. Painful ejaculation. Pain during ejaculation is not normal and may be a sign of significant changes in the prostate. 11. Persistent fatigue. Excessive and constant tiredness, even after rest, may indicate that the body is fighting something bigger, such as prostate cancer. 12. Swelling in the legs or feet. This swelling can be caused by blockages in the lymphatic system, something that happens in advanced stages of the disease. 13. Recurring urinary infections. Repeated infections may indicate that the urinary system is being affected by changes in the prostate. If you notice any of these signs, seek medical attention immediately. Early diagnosis is the most important step in increasing your chances of beating the disease. What really causes prostate cancer? Although prostate cancer is widely studied, experts still don't know exactly what causes healthy prostate cells to turn into cancerous cells. What we know is that this process involves changes in the DNA of cells, which begin to divide uncontrollably. Cancer usually arises when these cells accumulate genetic mutations that affect the natural cycle of cell growth and death. Instead of aging and dying as they should, these cells multiply out of control, forming tumors. Over time, parts of these tumors can break off and travel throughout the body, causing metastases in organs such as the bones, liver, or lungs. Although there is still no single cause identified, several factors are associated with an increased risk of developing prostate cancer. These include advanced age, with a higher prevalence after the age of 50, and a family history of the disease, which suggests a genetic influence. Another important factor is hormonal imbalance. High levels of androgens, such as testosterone, can stimulate the growth of prostate cells, increasing the risk of mutations. In addition, lifestyle factors can also contribute. A diet rich in saturated fats, obesity, and a sedentary lifestyle are often associated with more aggressive forms of the disease. Exposure to toxic substances, such as pesticides and industrial chemicals, has also been identified as a possible risk factor. Although these elements are important, it is essential to understand that not every man with risk factors will develop the disease. Likewise, men without known factors can be diagnosed with prostate cancer. Therefore, continuous monitoring of prostate health through regular exams is essential, especially for those who belong to higher risk groups. The sooner these cellular changes are detected, the greater the chance of avoiding complications and treating the disease effectively. Remember that prostate cancer does not appear overnight. Most of the time, it grows slowly, offering an important window for diagnosis and early intervention. Understanding the possible causes and acting preventatively is the best way to protect your health. Prostate cancer risk factors you need to know. Prostate cancer can affect any man, but there are specific factors that significantly increase the chances of developing the disease. Understanding these factors is essential to adopt preventative measures and ensure early diagnosis. 1. Advanced age, a natural risk. The risk of prostate cancer increases considerably with age. Men over the age of 50 are the most affected, with the majority of cases occurring in men over the age of 65. 2. Family history, the weight of genetics. If you have close relatives, such as a father or brothers, who have already been diagnosed with prostate cancer, your chances of developing the disease increase 2 to 3 times. This suggests that inherited genetic mutations may play an important role. 3. Ethnicity, a surprising factor. Black men, especially African American men, are more likely to be diagnosed with prostate cancer. Furthermore, they tend to develop more aggressive forms of the disease, although the reasons for this disparity are still being investigated. 4. Obesity. More than a number on the scale, being overweight not only increases the risk of developing prostate cancer, but is also associated with more aggressive forms of the disease. This is because obesity can alter hormone levels and stimulate the growth of cancer cells. 5. Diet and lifestyle, the influence of everyday life. A diet high in saturated fats and low in fruits, vegetables, and whole grains may contribute to the development of prostate cancer. A sedentary lifestyle also plays an important role, as a lack of physical activity reduces the body's ability to fight inflammation and regenerate healthy cells. 6. Exposure to chemicals, a hidden risk. Men who work in environments with pesticides, solvents, or other toxic substances are more likely to develop prostate cancer due to prolonged exposure to these carcinogens. 7. Hormonal levels, the role of testosterone. Testosterone, although vital for men's health, can become a risk factor when at high levels. It stimulates cell growth in the prostate, which increases the possibility of mutations. These risk factors do not guarantee that a man will develop prostate cancer, but they significantly increase the chances. If you fall into one or more of these groups, it is even more important to have regular checkups and adopt a healthy lifestyle. Early identification of risks can save lives. The best way is to prevent prostate cancer. Although it is not possible to completely eliminate the risk of prostate cancer, adopting healthy habits can significantly help reduce the chances of developing the disease. Here are the top strategies you can implement today to protect your health. 1. Maintain a balanced diet. A diet rich in fruits, vegetables, and whole grains is essential for prostate health. Foods such as tomatoes, broccoli, and fish rich in omega-3 have compounds that help fight inflammation and uncontrolled cell growth. Avoid excessive consumption of saturated fats present in fatty meats, fried foods, and processed foods. 2. Exercise regularly. Physical activity not only improves cardiovascular health, but it also helps regulate hormone levels and reduce inflammation in the body. Aerobic exercises, such as walking and running, combined with resistance activities such as weight training, are highly recommended. Practicing at least 30 minutes of exercise 5 times a week can make a big difference. 3. Maintain a healthy weight. Excess weight is related to more aggressive forms of prostate cancer. If you are overweight, consider gradual changes to your diet and exercise routine to reach and maintain a healthy weight. Losing just 5 to 10% of your body weight can bring significant benefits. 4. Avoid excessive use of supplements. Although many people turn to vitamin supplements, studies show that too much of some vitamins and minerals, such as zinc and vitamin E, can increase the risk of prostate cancer. Prefer to obtain nutrients directly from a balanced diet and always consult a doctor before starting any supplementation. 5. Perform regular checkups. The most effective prevention is still early diagnosis. Regular consultations with a urologist allow important tests to be carried out, such as PSA and digital rectal examination, which can detect changes in the prostate even before symptoms appear. Men over 45 years old or 50 years old without a family history should include these exams in their annual routine. 6. Avoid smoking and moderate alcohol consumption. Smoking is associated with more aggressive forms of prostate cancer and can make recovery after treatment more difficult. Reducing or eliminating alcohol consumption also contributes to better overall health, including prostate health. 7. Discuss your risk factors with a doctor. If you have a family history, obesity, or other risk factors, talk to a specialist. In some cases, medications such as finasteride or dutasteride may be recommended to reduce the risk of cancer, but these medications must be used under medical supervision. Preventing prostate cancer is a commitment to your health. Small lifestyle changes can have a significant long-term impact. Remember that prevention begins with knowledge and practical actions in everyday life. Why it's not too late to make a change today. If you are reading this text, you have already taken the first step to taking better care of your health. Seeking information. Now, it's time to turn this knowledge into action. Regardless of your age or your habits to date, it is always possible to make positive changes that could save your life. Prostate cancer is a silent disease and often only presents symptoms when it is already at an advanced stage. However, the good news is that, in its early stages, it is highly treatable and the chances of a cure are very high. Start taking action today. If you are over 45 or belong to a risk group, schedule an appointment with a urologist. These preventative exams are quick, affordable, and can detect changes before they become something more serious. If it's already part of your routine, congratulations. Keep prioritizing your health. Also, notice the signals your body may be sending. If you notice symptoms such as difficulty urinating, pain, or discomfort in the pelvic area, seek medical help immediately. As simple as they may seem, these signs can be an early warning, and ignoring them can have serious consequences. Don't underestimate the power of lifestyle changes. Adopting a balanced diet, including physical exercise in your routine and maintaining a healthy weight, not only help prevent prostate cancer, but also promote a longer quality life. If you smoke or drink alcohol excessively, consider reducing or eliminating these habits. They not only impact prostate health, but also increase the risk of several other diseases. And for those who live with the diagnosis, remember, it is not the end of the road. With advances in medicine, there are many effective treatment options that allow you to live a full life, even after cancer. It's never too late to prioritize your health. The time to act is now. Seek guidance, take care of your body, and inspire those around you to do the same. Remember, taking care of yourself is the greatest act of love you can perform, both for yourself and for those you love.